Welcome everyone. Thank you for joining us today. I'm Teresa Marantat, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 123,873 confirmed cases of COVID-19 in Canada and 41,048 cases in Ontario. Chatham-Kent has 356 cases and Sarnia-Lambton has reported 336 cases. Michigan now has 94,697 cases, with 13,314 cases being in Detroit. Today, we are reporting 2,454 cases of COVID-19 in our community, an increase of 2 cases from yesterday. One is a resident in a retirement home, and one is being investigated. 27% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 65% are male, and 35% are female. Our community has lost 71 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. 2 retirement homes are currently experiencing a COVID outbreak, as well as 2 workplaces in the agri-farm sector. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you're feeling confused or losing consciousness. Windsor-Essex will soon have 3 COVID-19 assessment and testing centers: Erie Shores Healthcare in Leamington and Windsor Regional Hospital, Olette Campus. An additional option on Monday and Tuesday will be a drive-through testing from 9 to 4 adjacent to the St. Clair College Sportsplex. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain isolated pending your test results. To check your results, please go to wechu.org and click View Your Results to access the online test result portal. If you're unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, everyone, and thank you for joining us again today for our epidemiological summaries. Here is what we will cover in our presentation. Since there's a lot to go, I will highlight key points in each slide. As mentioned before, this is the epidemic curve. We use this to assess the progression of the disease, whether we're in the community or in an outbreak situation. This particular epi curve is created to show the number of confirmed cases by the date it was reported to public health. On your vertical axis, you have number of confirmed cases, and on your horizontal axis, you have the date that these cases are reported to the public. We have seen some cases up and down throughout our course of the pandemic. Right now, we are seeing somewhat a steady number at the tail end of or the beginning of August. To capture all these day-to-day variation, the other way to look into it is to look at a 3-day moving average, and this 3-day moving average tries to be a little bit more capture the fluctuation, day-to-day fluctuation of cases around the region. What we can see again is we have seen a huge spike in the month of July, and since then we are seeing a steady decline and relatively a stable case count since the beginning of or the middle of August, what we're seeing. To break it down further, this particular epi curve is to show the number of cases in agri-farm workers versus non-agri-farm workers to date. Outside of since the beginning, obviously there were very few cases of the agri-farm workers, and then we started seeing some uptake in the middle of May, and it's still continuing, but up to a level where it's gone down significantly. This graph looks at the cases that present to our emergency department in Windsor Regional Hospital and Erie Shores Healthcare with symptoms that are related to COVID. This is not a confirmed diagnosis rather than a symptom that individual is presenting with, which could include cough, fever, pneumonia, and many other respiratory symptoms. The green line is the current 2019-2020 season, which starts in September 2019 and goes until the end of August 2020. We are currently in week 34. The blue line is the 2018-19 comparator. As we have seen in the previous presentation, we have seen a high number of cases in March to May, but then relatively stable. We have seen some uptick in the end of the month of July, and it's now stabilizing in the region. Focusing just on the Erie Shores Healthcare, they have seen a huge spike at the end of July, but now have seen some decline, and in the last week they have seen some uptick, but otherwise generally it's relatively stable and coming to their usual baseline compared to the previous year. This particular graph looks at all the tests that are conducted on unique individual by week in Windsor and Essex. In total, more than 75,000 tests were completed, and among 49,800 unique individuals. So roughly 50,000 of our residents in Windsor and Essex have been tested as of August the 16th. Looking at our test, our current percent positivity is 1.5%, which is represented in the orange line. If we are looking at unique individual that tested positive last week, this is closer to 1%, which is the red line. Last week, approximately 708 tests were completed daily, and 700 unique individuals were tested daily. So this particular graph basically highlights the number of tests that are conducted daily as well as weekly, which is an indicator of how many individuals are going through the system. We have heard some questions from people whether how many tests were conducted every day or weekly basis. So this is a good indicator that on an average we are pretty much doing the testing regularly, and the testing capacity has increased significantly as much as the number of tests that are coming back positive is also presented here. This particular graph shows the 7-day moving average of case counts on a weekly basis. As we can see that the blue line includes all of the cases, that includes Agri-Farm as well, but the green line indicates the cases of 7-day moving average if we remove the Agri-Farm workers. No surprises here, as we can see end of June, beginning of July, and mid of July, we have seen an increase in the case counts, mostly attributed to the Agri-Farm workers, but then it started to go down, and more recently it is closer to the provincial average and is trending in the downward direction. Overall, looking at Windsor-Essex rates by reported week, we can see in the last 3-4 weeks there was a spike, but then it's trending down and it's coming towards what the baseline is for our region. This particular graph shows the percent of positive tests reported in 1 day and 2 day of the test dates. It's an indicator of how quickly we are getting the test results back from the lab. We can see that we have seen some fluctuations in terms of number of cases that are reported to us in a timely manner, but most recently what we can see is the tests that are reported back to us is still under 2 days for most of the part, but we have seen some variation, and some days for whatever reason the test results are not reported as quickly to us as we like to see. From a public health perspective, what we can see is this particular graph shows the percentage of new cases that are investigated within 100% within 24 hours of receiving them, and so far our health unit has initiated the investigation of all those cases 100% within 24 hours of reported time, despite the high number of cases that we have seen in a few days. Looking at the regional and provincial rate, Windsor-Essex continues to have the highest rate in the province, and our rates are higher than the provincial average. For us here locally, of course, we have seen a significant increase in the beginning of the pandemic through the travel, and then we have seen a surge in the long-term care population, and then we have seen a surge in the agricultural farm population, and right now it's relatively coming down to something which is off a baseline from our perspective. Looking specifically at the rate of these cases by municipalities, no surprises there. Due to the agriculture farm sectors, the highest case rates were noticed in Leamington and Kingsville, while the rest of the region has seen a steady number of cases across, except for Windsor, which is somewhere in the middle, but higher than the rest of the municipalities. This map displays the rate per 1,000 residents by dissemination areas. The areas with no colors are places where there haven't been any lab confirmed cases. Please note the scale that we are using. It could range from 0.5 cases per 1,000 population to 368.2 cases per 1,000 population. The scale will change in each map and is a relative comparison to the cases in a geographical distribution. As you can tell from the previous slides, in Leamington and Kingsville, the darker colors, blue and purple, indicate higher cases in these specific dissemination areas. Relative to the county, rates are low in the city of Windsor. Please note that this does not mean that these are the areas, or these are the dissemination area where these cases were infected. Rather, they are the area where these individuals reside. Cases may have been exposed to outside of their dissemination areas and can still show a residential address of the dissemination area that is shown in the map. Looking further just at the city of Windsor, by the rate per 1,000 resident, once again, areas with no color are where we do not have any lab confirmed cases identified in that particular region. As described in the previous map, this map is comparing the cases only in Windsor, and the scale is from 0.8 cases per 1,000 population to 27 cases per 1,000 population. This map looks at the currently active cases that the health unit is tracking per 1,000 population. As expected, the rates are higher in the areas of Kingsville and Leamington predominantly because of the agricultural farm sector. Looking at the city within the city of Windsor, we once again see some pockets across the city, like in the East End by the university, but there are little areas in central Windsor. But overall, most of the areas in the city of Windsor do not have any active cases, at least to our knowledge. Please note that this does not mean that these are the cases or these are the areas where the risk is high. This is more of an indicator of where these individuals live, and this should not be interpreted with the sense that those are the high-risk areas or one neighborhood is better than the other. It's just an indication of where these individuals currently living right now. This figure looks at the age breakdown by percentages for each municipality. The green and orange line shows that there are a high number of young adults across each municipality. This is higher in Leamington and Kingsville due to the agricultural farm sector, who are of the working age between 20 and 39 years of age. The rest of the municipality has seen some similar pattern with some variation in Amherstburg, where there was a higher number of positive cases among young people between 0 to 19 years of age, and in Tecumseh, where there is a higher proportion of seniors or older individuals, 80 plus, and the rest of the region is relatively comparable. Looking at the overall cases by age and sex, this is what it looks like, nothing different. We have noticed that our cases were more in male compared to female, but the age distribution is relatively stable across the region, with most of these cases in the working group or working age between 20 and 40. And it is now compared with the last 2 weeks, and not a lot of changes except for some new cases that went down from the overall average between the age of 30 to 39 years. Looking at the overall distribution of COVID-19 cases by municipality, the Leamington continues to be the municipality where we had most of the cases in the region, followed by City of Windsor and Kingsville. The rest of the municipalities have seen some relatively smaller number of cases across the region. Distribution of COVID cases by municipality in the last 30 days, and no change, relatively similar, where Leamington, Windsor, and Kingsville continues to be to take the most of the cases of our region. Looking further, in the last 7 days, we have seen an uptick in the cases in Leamington linked to the agri-farm sector, but the rest of the municipality or the rest of the trend is similar to what we have seen previously. In the last 7 days, 52% of our cases were from agri-farm sectors, which is evident in terms of even where these cases are coming from. But the rest of the cases are still in the outside of the agri-farm sector and are being followed by the health unit. Looking at the epi curve by reported date by each of the municipality, this is for the city of Windsor, and what we can see is we have seen a spike in the end of July, but now we're trending down and relatively stable compared to the baseline if you want to go back to all the way up to June. So it's trending in the right direction. Looking at Amherstburg with low case counts, we can see the epi curve looking like this, but it's all because of low case counts overall in the municipality. The town of Essex, this is what it looks like, overall 7-day moving average. For Kingsville, that has seen most of the cases, we have seen some ups and downs, and more recently the number of cases are going down, and which is reflected in the overall moving average. Either we're looking at the overall community overall moving average versus community moving average minus the agri-farm sector. It's all going in the right direction. Leamington shows a similar picture with 2 spikes and then coming down towards their baseline and the cases trending down. Similar for Lakeshore with few case counts. It's relatively stable, similar in LaSalle and Tecumseh. Here we are looking at how our cases are acquired of COVID and focusing on the cases more recently. What we can see is most of the cases in our region in the last month or so are linked with the close contacts, with some occasional cases as a result of travel, and some cases are still as a result of community transmission that we can see in our region. All the community transmission are represented in the yellow or orange line, and the travel cases are shown with the dark blue line, and all the close contacts in green line. So looking at the exposure specifically in the agri-farm sector, most of these cases, no surprises there, is as a result of close contact, with still some cases coming from travel and community transmission. When we are talking about the travel cases in this group, these are the people who are new to Canada and developed disease during their 14 days quarantine period, and the community transmission where we cannot link the case with any known exposure. Looking outside of the agri-farm sector, it is similar, with some cases as a result of travel, while the community transmission continues to be at a relatively baseline and more in the month of July and trending down in the month of August, which is definitely something that we'd like to see. From the healthcare worker status, 22% of our cases were healthcare workers who worked in Michigan, whereas the majority of the cases are local healthcare worker working in our health industry in Windsor and Essex. The other question that we always ask is any kind of underlying chronic condition. Still 1/4 of our cases were from individuals who had some kind of chronic or underlying medical condition, while the majority had no chronic or underlying medical condition. With respect to symptoms, it is still not changed. Cough, headache, and fever continues to be the most dominating symptoms when people are identified as confirmed for COVID. Please note that an individual can present with more than one symptoms, and these numbers do not add up. Looking at our hospitalization and ICU capacity, ICU bed utilization in our region, we have seen a spike in the number of COVID-related hospitalization in the end of July, beginning of August, and now it's trending down and relatively stable, and at least in the last week or so. We are continuing to see a decline in the COVID-19 cases with respect to ICU utilization, and the number of ICU beds utilized are trending down. Looking at overall health system capacity, it is still it's also unchanged from the previous weeks. We have seen the number of acute beds occupied in our health system continues to be close to 85%, which is the threshold that we like to see some capacity in the healthcare system to cope up with any increase in the number of cases of COVID in the region. Similarly, in the acute care bed, we would also like to see ICU beds occupied. We like to see it below 50% to cope up with some of the challenges. The ICU bed capacity exceeded 50% for a brief period of time, but it's trending downwards now. So where are we with all these cases? The good news is more than 93% of our cases in the region are resolved, while only 3.3% of our cases are currently self-isolating. Unfortunately, we lost roughly 3% of our COVID-19 cases in our community. Looking at who lost their life, more female lost their lives to COVID as compared to male, and majority of the individuals who lost their lives in our region are individuals who are 80 years and older, but our youngest case that died in our region is between the age of 20 and 29. Comparing our case fatality rate with the province, we continue to be below the case fatality from the provincial perspective, whether we are talking about the long-term care home, retirement home, as well as in the community. So overall, in Windsor-Essex, these case fatality rate continues to be below 3%, whereas the provincial average is closer to 6.8% or close to 7%. Looking at the doubling time day-over-day comparison, in the month of July and end of June, we have seen our doubling time relatively low, which basically means that our cases are increasing quite rapidly. But throughout the month of August, we have seen our cases count, our case doubling time increased, which is the positive sign. That means we are not seeing many cases. And more recently, what we have seen compared to the provincial and Canadian average, our doubling time was better than the provincial and the Canadian average. The most recent estimated mean R0 is 0.66. When the R0 is less than 1, every infection caused less than 1 new infection, signaling a decrease in the virus in the community. When the R0 is greater than 1, each existing infection is causing more than 1 new infection. Our R0 estimate varied greatly due to the influx of cases from the agri-farm sectors, but in the recent days, we have seen a decrease across all cases in Windsor-Essex, and the shaded area in this particular graph demonstrate the variation that we see. So in summary, Windsor-Essex continued to see a decline in the cases overall, and the primary source of exposure continues to be close contact with a confirmed case. COVID-related hospitalization have seen some ups and downs, but right now it's stabilizing, and ICU cases are continuing to decrease. The day-over-day doubling time have also seen some variation, with Windsor-Essex is now getting on par with the provincial and the national average, and in some days it's better than the provincial and national average. The R0 effective value is still less than 1, which is a good sign, indicating a decrease in transmission in Windsor-Essex. And our cases are resolving, and the number of active cases are relatively low compared to where we were before. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Any questions from Windsorite?
None at this time, no.
Any questions from CBC?
No, thank you.
AM 800?
Dr. Abed, going back to what we discussed earlier this week in regards to the shopping trip, demonstration, protest, whatever you want to call it, that's happening tomorrow at the mall, will the health unit have enforcement officers out there?
Yes, our team is in discussion with the City of Windsor Police and also their bylaw officers, and they're all talking about the approach and how they will approach the situation. Obviously, we don't want to be in any type of confrontation situation, but I think the bylaw enforcement officers, our officers and police will be there on site to ensure that the bylaw is followed, and any violation would be dealt with accordingly.
I know in the past you have told us and others that the focus is education when it comes to the orders and the bylaws. Is it time to throw the education period out the window? Because I'm guessing these individuals that are going to the mall tomorrow, if they go to the mall tomorrow without the face covering, they know what the orders and bylaws are. Is it time to throw away being Mr. Nice Guy and start issuing some fines?
Well, it is unfortunate that we are in this situation, and I think I don't know what to say, but it's just basically it's just common sense, and people. I respect everyone's opinion, but when it comes to public health, public safety, it doesn't matter. We have to. There are rules in place. There are things in place. And it's not that these people do not have any option. If they want to show by force that this is what they want to do, and then put the law enforcement officers or put the people who are trying to do the good thing in a position, I would blame them. I would not say that it's their right. No, you willingly, knowingly, you are doing something to provoke anyone, to provoke an event, which would make everyone look our community look bad. I don't want us to be compared in a communities where there is all these blatant disregard of law, and there all these rules, all these recommendations are for everyone's safety and for benefit. It doesn't benefit me. And I think it's just people need to know as well that these rules are for everyone's safety. Everyone have their own rights. Everyone have the ability to shop. Everyone have the ability to go and take care of whatever they need to, whether they are wearing the mask or whether they are unable to wear the mask. There's a huge difference with people that are unable to wear the mask versus people who do not want to wear the mask. And I think people, if they do not want to wear the mask, fair enough. But do it where you can. You cannot and you should not do it in places which is accessible to public. What about the rights of the rest of the people? Are people who are following all those things and people who are concerned, what about their rights? Isn't it their human rights? Isn't their violation that they are not allowed to be in position and in places? The law is there for everyone, and it takes consideration for all these people, all these nuances. So it's unfortunate that we are having this conversation, and it really is it just basically it just bothers me, and I don't have anything to say. And people who are trying to present that they are speaking or they're having the voice of everyone out there, they're not. They are just few handful of people. They are in every forum. They are in everywhere, whether you're talking about Windsor or talking about any other cities, any municipalities. There are people that's their full-time job right now. It's just to go after these type of messages, and doesn't matter what kind of message you want to give them. They're not listening. They're not following because they do not want to follow, and it's unfortunate. And I really hope that sanity will prevail and people follow it. We definitely don't want to be in a situation where Windsor-Essex or anyone else are seen in any kind of negative image.
Thank you very much. Have a great weekend.
Any questions from Blackburn?
Yes, I'm just curious if you know if there's been more testing conducted at the farm that saw 21 cases this week.
So our team has been in constant contact with them, and we are working with them to figure out the next steps.
But no additional testing has been done so far?
The additional cases that we picked up was a result of additional testing, and we continue to work with them to ensure that they have good systems in place, good screening process in place, and make sure that everyone who is currently working are identified, and any appropriate actions can be implemented.
Thank you.
Any questions from Windsor Star?
Yes, good morning. Teresa, this morning you reported one new case among a retirement home resident and one under investigation, but I'm seeing at one of the retirement homes experiencing an outbreak, there are actually 2 additional cases among residents and 1 additional case among a staff member. Just wondering if you can speak to that discrepancy in the reporting on the website.
So, am I on? Okay. So, we switched over to the new CCM, software, or the program that the province has from our IFAS reporting. So there will be some discrepancies. The new cases, we pull every night from our actual lab results. So the 2 cases I'm reporting would be accurate, unless between the time I got the report and what's posted on our website is the update. But really the new case, one is a resident that's in a retirement home that's currently an outbreak, and the other one we were investigating more information. So that's what I have. The website may not be completely accurate at this time based on the transition into the CCM platform. So
Okay, so we should report the information that you're providing verbally instead of at this current time during the transition period, what we're seeing in some of the other breakdowns and numbers on the website?
Yes, you'll see that I did not report resolved and active cases and self-isolating based on the fact that we're reconciling our old system and the new system. So there'll be a little period where epidemiologists will be confirming all the information and making sure that it's accurate. So right now, there will be a couple days of information that's lagging or needs to be reconciled and updated.
Okay, thank you.
Any questions from CTV?
Yes, good morning, Doctor. Not to beat up on the mull talk here, I know you're sick of talking with this one, but I assume you're okay with a band of people with medical conditions that can't wear a mask that just happen to want to go shopping together, right?
Absolutely.
That's okay. Is that okay?
Yeah, I think absolutely. I think it's important that people need to realize that there are individuals who cannot wear masks for medical reason, and these people, I think they should be respected as well, and they should be given the same rights or same options for shopping and doing what they need to do. But what we have realized and what we have seen is people who have some medical conditions, I think they're more mindful and more respectful of everyone else, and they are following it. What is being shown or presented is these people who do not want to wear the mask, and then they're using this as an excuse for people who have a medical condition. So I think we just need to be very clear. People who have a medical reason, who have any type of cognitive issues, any type of concerns developmentally, if they cannot wear the mask, they don't need to. And they do not even have to prove any proof of certification of exemption or anything like that. It's not a requirement. We do not want to create barrier for those people. I think it's just about respecting everyone, and it's respecting what the recommendations are, what the bylaws are in the region, and just following it. And if people who do not want to follow it, I think they should be seen as such that they do not want to do it, and it has nothing to do with any medical condition. It has nothing to do with any exemptions. It's just because they do not want to follow the law.
Very good. And then just as something we talked about a couple of months ago, antibody testing. Just curious, so have the kits ever come in? Is that ever going to be available to the public?
So the antibody testing right now, it started with Public Health Ontario with very specific population, and it's very limited in terms of how it's being used right now. The hope is it will be expanded, and there are a number of work that's been done with the lab in terms of building the capacity for antibody testing and the appropriate indication of how these testing are done. So it is, I think, last time when I remember, it is available, but in a very limited capacity at this time.
Okay, I just wondered where that was at. I know we talked about that a while ago. So, okay, thank you, sir. Have a good weekend. Appreciate it.
Thank you.
Thank you, everyone.